Hi there, I'm Sherry Sampson, your fitness program manager at the Forest at Duke, and I want to talk to you about fall prevention today. Each year, 3 million older adults are treated in emergency departments for fall-related injuries. More than 95% of all hip fractures are caused by falling. Falls are the most common cause of traumatic brain injuries. An older adult falls every second of every day, according to the CDC. While accidents among all ages occur, many falls among older adults can be prevented. Physical changes take place as we age. Decreases in vision and hearing are very common. Loss of muscle, poor range of motion, neuropathy and pain can also contribute to difficulties in balance. Incontinence, which may cause frequent trips to the bathroom, especially in the middle of the night, is also problematic. Chronic conditions that cause lightheadedness, numbness, or confusion most certainly put folks at higher risk of falling. Many older adults are on medications that can affect balance. The CDC explains 3 key systems that influence our balance: visual, vestibular, and somatosensory, which is sensing our body in space. So these 3 key systems contribute to balance. Behavioral factors such as sedentary lifestyles, consuming alcohol, experiencing isolation can also increase fall risk. Environmental factors are also very important. Uneven sidewalks and poorly lit hallways are examples of this. Oftentimes, hazards in our own homes, such as throw rugs or clutter, again, poor lighting, can be the culprit. There's currently no ideal instrument or calculator for primary care doctors to decide who is at greater risk for falls. And the best predictor of an increased risk of fall is a history of falls. The U.S. Preventative Services Task Force found adequate evidence that exercise reduces the risk of falls by a moderate amount. Current evidence suggests that exercise therapy provides the most benefit for decreasing falls and injuries from falls. So this is great news, right? We can all do this. So thank you for tuning in today. Now we will hear from some familiar faces at the Forest from different disciplines, talking to you about their suggestions for preventing falls. Thank you so much.
You should always tell your healthcare provider if you had a fall, because having had one fall or even a stumble makes it more likely that you might fall again. And there are things that we can do to prevent you from having another fall. While in the office, your healthcare provider should check your balance at least once a year and every time you've had a fall or a stumble. This may be done by having you stand on one foot, stand with your feet together, stand with one foot in front of the other. We also will check how fast you can walk, and any trouble, if you have trouble standing on one foot, if you can't do that for at least 10 seconds, if you walk very slowly, if you can't stand with your feet together or with one foot in front of the other, then we'll talk to you about going to see a physical therapist to get some therapy specifically related to preventing falls. We'll also check your medications carefully, because certain medications can increase your risk of having a fall. The ones that are most likely to contribute are sleeping pills, pills for anxiety and depression, and sometimes blood pressure medicine, but only if it's making your blood pressure too low. Many chronic conditions also increase your risk of falling. These can be arthritis, and there are many things that we can do to prevent or ameliorate the effects of those chronic conditions. So we'll talk about all of those when you come to see your healthcare provider. For example, for knee arthritis, we can have you visit the physical therapist or do other specific strengthening exercises to strengthen the muscles around your knee, and that will help you and prevent future falls and also help the pain from the arthritis. We'll also look at your feet when you come to the clinic and make sure that there's nothing about your feet that is preventing or causing falls. So if you have painful calluses or toenails that need to be taken care of, then we might recommend that you go see the podiatrist to get those trimmed and taken care of. The most important thing you can do to prevent falls is to exercise. You need to do both balance and strengthening exercises, and as well as just plain walking, but specific exercises related to strength and balance are important too. And another thing that we might recommend is for you to take vitamin D, because if you're deficient in vitamin D, taking vitamin D will help prevent falls.
Hello. September is Fall Prevention Month, so I just want to take a moment and mention a few things regarding falls, safety in the home, and asking for help. Something very important you can do to prevent falls in the home is to look around a little bit and see if there's anything that could lead, to a risk. Area rugs, a loose bath mat, cords from the television or the lamp. You can also, if you don't feel like looking around that you can spot everything, you can also ask your doctor for a prescription to see the occupational therapist, and they will come and do an in-home evaluation for safety, in case there's anything you think, could be made safer. Another thing that you can do to avoid the falls in the home is just to make smart decisions. If you're thinking about what you're doing before you do it, let's say you're bringing over something to eat and drink to the table, you don't want to have both your hands filled at the same time. You should always have one hand free to steady yourself, to hold on to a piece of furniture, but to think about it. Think about your tasks and how you can make them safer. If you're a person that gets up to go to the bathroom at night, you might want to try using a nightlight in the bathroom and making sure that the path from bed to bathroom is clear before you go to bed. Don't kick your slippers off and leave them there. It's really about, being thoughtful and thinking ahead of your tasks so that you can make sure safety is your priority and keep from a senseless fall, that can lead to other things, a fracture and then having to go stay in a rehab downstairs in the rehab center. So you might want to just think about your tasks before you do them and always have safety at the forefront of your mind. Also, don't be afraid to ask for help. If you have a package delivered and it's too big, ask somebody to help bring it to your home. If something doesn't look safe, but you're not quite sure, call your social worker. We'd be more than glad to come over and give it a look and see if we can, if we too think it's unsafe, and then we can arrange for that thing to be fixed, whether it's through maintenance or, if we can get IT to come and get your wires set together. Don't be afraid to ask for help. And that's another in line with that is don't be afraid to use your pendant. Safety is one of the reasons you moved to a place like the forest, and one of the benefits is that you have help available to you. I know a lot of you do think that if you ask for help or you push your pendant, that the next thing you know that I'm going to come and bring you down to health and wellness, but it's just not true. Ask for help. Asking for help can definitely make a difference in you having a fall with a very bad outcome, or just needing a little bit of help, or if you're not feeling well. That's what the pendant is for. You really should always ask for help when you need it. And lastly, you will have the same social worker throughout your time here, so you really should utilize us. Start a relationship while you're in independent living, and one that you can rely on and you can trust. And then, we can help you with these kinds of things. Your social worker is a valuable asset to you. So use us and be safe and think ahead. Those are the things I can tell you to keep you safer at home. Okay? Have a good day.
My name's Amy Cook. I'm one of the physical therapists here with Legacy Therapy Services, and we provide therapy here at the Forest at Duke. And I am here to talk to you about how we manage residents when they're referred to us with a fall risk or a history of a fall or anything that we think may contribute to some balance deficits. So when we receive a referral from therapy, we schedule an appointment and have the resident come to our therapy department, or we can come to your home, whichever works best. And there are certain areas we typically assess when we see you. So a couple of the first things we'll talk about with you is, have you had any falls or near falls, and kind of talk about how they happened. And then we look at your environment and talk about maybe some changes, some safety issues that you could consider to make sure your environment is nice and safe and reduces your fall risk. And then we actually get into the specific assessment. We'll look at any medications that you're taking that could increase a fall risk due to balance, fatigue, sleepiness, any issues like that that might make you feel a little dizzy or unsteady. And then we'll talk about your vision and do a general assessment during the balance to see if your vision could potentially affect your stability and your balance. After that, we'll move into more of a physical assessment. We check your strength and your flexibility. We check your sensation, your joint range of motion, and then we do specific balance assessments, because of all of those areas can affect a person's balance. For example, somebody might not be very flexible, and if you go to reach for something, you could lose your balance just because your body can't move that far, just because of some tightness or restrictions in your back, your neck, your hips. But we also talk about pain, because pain can definitely affect a person's balance. So sometimes if a person's referred to us for pain, I'll go ahead and check your balance anyway, just to make sure that what you're suffering with is not affecting your ability to move safely. So after that, we will work together on specific interventions to help you with whatever we find, whether it's a weakness issue, a vestibular issue, a flexibility issue. Whatever we find during the assessment, we'll go over with you, and then we'll put a plan together to work on those deficits. And we have a lot of equipment here in the therapy department. We have a balance system here that we can use for exercise and testing. And then we also have a lot of equipment that allows us to really challenge you with activities and movements that we would not recommend you do by yourself at home. And then once you reach a certain level and you're ready for discharge, we usually try to incorporate some type of program or exercise routine that you will continue on your own, whether it be with a group or individual. And then we will work with any group or individual person that you might be seeing or working with or helping you to continue to maintain the level you're at. So if you have any questions, please don't hesitate to call us here at the therapy department at the Forest at Duke. Thanks so much.
Hi, thank you so much for tuning in today for our discussion on fall prevention. I hope you learned a lot about the great resources we have here at the Forest to help you stay healthy and strong. If you have any questions about today's program, please don't hesitate to reach out to me. I look forward to hearing from you. Take care, everyone. Bye.